Good afternoon, everyone. We'll get started here in just a minute, waiting for a few more people to sign on. Thank you. Okay, well, it's just after 12:30, so we will go ahead and get started. I want to first of all thank everyone for joining our call today. My name is Ann Keenest. I'm a senior wealth advisor with Old National Investments. Myself, along with Paul Sturck, also a senior wealth advisor with Old National Investments, are thrilled that you are taking the time to learn more about healthcare costs and retirement. Old National Investments offers a broad range of strategies and services to meet your needs. So feel free to reach out and we'd be happy to guide you. Hopefully, all of your questions will get answered within this presentation, but if not, please put them in the chat and we will get answers to you after the webinar via email or phone. Any personal situations can be addressed outside of the webinar. Our guest speaker this afternoon is Susan Wood, Senior Retirement Strategies Group Consultant. Susan Wood is a senior consultant with the Retirement Strategies Group of Pacific Life's Retirement Solutions Division. She brings more than 25 years of industry experience to her role, including experience in financial planning and wealth management. She has worked in a private planning firm, a joint venture with a trust company, broker-dealer firms, and financial services companies. She has also provided continuing education to financial and legal professionals. Without further ado, I'd like to introduce our speaker, Susan Wood. Susan, the floor is yours.
Thank you, Ann and Paul, and thank you everyone for joining us today. We know you have a lot of different ways and opportunities that you can learn how healthcare and retirement will matter to you, and we appreciate you spending a few minutes with us. So we're going to talk about healthcare and retirement, and the prescription really is planning. It's understanding a bit ahead of time what might work for you. All right, so first, a little warm up here for you to think about. You can learn everything you need to know about Medicare in a 45-minute presentation. This is true because healthcare in general and Medicare in particular are easy, straightforward topics, or this is false. Medicare has many parts, each of which has its own premium and cost-sharing structure, and information about Medicare changes annually, if not more often. Well, I am going to have to go with false on this one. I think Medicare is actually a very complicated subject, especially for people that have any medical issues. So what we'll talk a little bit about today is what I like to call the when, what, and how. When you can enroll, what the enrollment options might be, and a little bit about how much everything will cost. Now, be aware, cost is highly regional. Certain parts of Medicare, we can say, we know what this cost would be. In other situations, where you live will influence what your cost is. So the good news is you're 65. Now, I want to take a moment here because I know that not everyone retires at 65. Some people wait longer, some people retire earlier. And one of the questions I often get is, look, I am going to retire at 62 or 63, but before 65. What are my options for medical care? Well, that will depend. if your company offers medical care, some companies will offer medical care to early retirees, and then those retirees shift to Medicare at 65. Other companies don't. If you don't have access to something through your former company, you do have the Affordable Care Act exchanges, and those are a very good option for getting coverage before 65. A note, remember that there are subsidies available on the exchange. Those subsidies are based purely on income. So if you happen to have a low income year because you are using some savings in your first year or two of retirement, then that might make you eligible for subsidies. If you have a higher income, then you might not be. Those prices can vary. For two people 65, I've heard everything from around $1,200 a month to over $2,500 a month. So you'd have to check what would work for you for people between 60 and 65. Now, let's look at that happy 65th birthday. So, age 65, unless you are covered by a current employer plan that has 20 or more employees, you or your spouse. So, put that down as one thing. You have at that time what's called your initial enrollment period. It's a 7-month window that says you can now enroll for Medicare. If you have already claimed Social Security, you are automatically going to be enrolled in Part A. You have to actively enroll in Part B, Part D, and Medigap or Advantage. We'll talk about that, but it's automatic with Social Security for one piece. Now, what if I'm 65 and I do need the medical coverage, but I'm not ready to claim Social Security? Then you have to actively enroll. You just go online with Medicare and you enroll. Now, this initial enrollment period is 3 months before the month you turn 65, the month you turn 65, and the 3 months after you turn 65. So you have 7 months in total that's part of your initial enrollment period. If you enroll during this period, and we'll talk about having coverage elsewhere because that changes it. But if you enroll in Medicare during this period, then you followed all the rules, you don't get any penalties for late enrollment, etc. Now, if you're really worried about coverage, sign up early to avoid a delay. To get Part A or Part B, you must sign up during the first 3 months before you turn 65. So you have that 3-month period. I could go in month 3 before or 2 before and sign up. If you wait until the last 4 months, so that's the month you turn 65 and the 3 months after, your coverage starts the first day of the month after you sign up. So if you don't want a gap, then a couple months out, go ahead, sign up. Now, the good news is congratulations on retirement. So let's think about this a minute. We just talked about enrolling in Medicare, and now we're talking about retirement. How come? Well, many people do decide to work past 65. If group coverage ends, if covered by a current employer past age 65, and the plan covers 20 or more employees, you have something called a special enrollment period. So think of a large company. I'll use Pacific Life as an example. You know, Pacific Life has more than 20 has 20 or more employees. So if you were 65 or older and working for Pacific Life would be your primary provider of coverage. So you might say, I don't want to pay for Medicare if I'm not really going to use it. And that means when you retire, though, you have an 8-month period. I can enroll anytime while I'm working, and I can also enroll during that 8-month period. And a lot of people enroll a couple months before. You may be doubling up on coverage for a couple months because you have your plan and at work and you have Medicare, but it makes a smooth transition. And you also have beginning the earlier of the month after employment ends or the month after current group employer group coverage ends. Now, let's think about this. This is sort of a coordination of benefits. I think a lot of you are familiar with that term. If you have access to more than one medical plan, those plans coordinate benefits. Somebody's primary, somebody's secondary. Now, if you have that 20 or more employee group health plan, they are the primary payor. If you're past 65 or older and working for that type of company, you have to have the group health plan because Medicare only pays what the group health plan won't, whether you have it or not. So be very careful about making sure that you've got that group coverage. Now, what if you have a group health plan because you or your spouse are working and the plan covers fewer than 20 employees, so a small business plan? Then Medicare is the primary payor. That means I can pay for the group health plan, but Medicare is going to pay coverage first. So why might I even have a group health plan in that circumstance? And the answer is, well, because Medicare doesn't cover quite as much as the group health plan, or the health plan offers benefits Medicare doesn't. Now, what if you have a group health care plan with retiree coverage? Then Medicare actually goes first. So it goes in front of retiree coverage. Whatever Medicare doesn't cover, retiree coverage might. And then lastly, COBRA. This is listen up time, because I've had this happen and it's very frustrating because people end up with penalties because they didn't sign up appropriately in the appropriate time frame for Medicare. COBRA is secondary to Medicare. So let's say you are 64 and you say, I'm going to retire and I'm going to use COBRA. The day you turn 65, COBRA is secondary to Medicare, so you have to make sure you're signed up. If, as I've had some people try to do, you say, well, I'm just going to sign up for COBRA because I like the coverage better than Medicare. You can do that, but if you haven't signed up for Medicare, COBRA will not cover anything that Medicare would have covered. So you really do have to be sure to understand how these work. Now, there's a bit of a caution here. Be careful with former employer coverage at age 65 for two reasons. COBRA and retiree coverage do not entitle you to that special enrollment period if you've retired. So let's say, like I said, I retire, I go on COBRA, I'm past my Medicare start date. I don't have a special enrollment period when I go off COBRA. I have to sign up for Medicare within that 8-month period after I retire. Now, what about the special enrollment period? Now, this special enrollment period is a missed enrollment for exceptional circumstances. Natural disaster. I don't have access to a computer. I've lost all my records. I don't have any way to sign up. And I know this is when the last time I can sign up. You may be able to get help with that. An emergency of some kind. No, an emergency is not, I forgot to sign up. An emergency would be, you were in the hospital and unable to manage that. Incarceration, employer health plan error. Some employer says somewhere, no, they're covered, but you weren't. And then losing Medicaid. This more applies to people on disability, that you might lose Medicaid and then be eligible for Medicare because of disability. And you would have to contact Medicare directly for that. Now, that said, it's always better late than never, right? Unfortunately, some people will miss. They'll miss by accident. They'll miss because they say, I'm healthy, I don't want to pay for any of this. Then you have the general enrollment period. That's 3 months each year, January 1 to March 31. Late enrollment penalties apply, and late enrollment penalties under Medicare are for life. Part B has a 10% a year penalty. If you miss by 2 years, you pay 120% of the premium for life. So it's very important to not let that happen. And then coverage will start the first day of the month after you sign up. So you really do have to be you know, I like to say sort of on top of it with that. Now, Medicare offers 3 different enrollment periods, so we're going to put this in context a little bit so you can sort of see on the same page. Honest. The initial enrollment period, right? That's the initial 7-month window. The special enrollment period, that 8-month window, because I worked past 65, I had employer coverage, and now I've retired and it's time for me to sign up. And then the general enrollment period, which is that annual 3-month period. If I missed everything else, I can get in then, but I will have penalties assessed. And all of those are the 3 enrollment periods. All right, so we've talked about when can I enroll? Now, what am I going to get? Well, there are 2 primary ways to get Medicare coverage. There's Original Medicare and there's Medicare Advantage. Original Medicare is public, that's the public program. It operates on what is called a fee-for-service basis, which basically says you can go to any doctor anywhere in the US and its territories and say, I would like treatment, and you will be covered under Medicare. Medicare Advantage is the benefits of Original Medicare and Medigap covered through a private insurer. Those are HMO or PPO, determined network programs. And then prescription drug coverage is private, but it is part of the Medicare program. And the plus there is they sort of have to take you. So let's look at Original Medicare. That's what a lot of people think of. That's Hospital Part A and Medical Part B. So Part A, inpatient hospital care, skilled nursing facility for an injury or illness for which you have been hospitalized for 72 hours or more, and for which you've had 3 midnights, and for which you are expected to maintain or improve. So, no custodial care. Now, I know this changed several years ago, but another point about skilled nursing. So let's say you have some chest pains and you go to the hospital and they look at you and they put you in a room and they say, we're going to observe you for a couple days here. We're a little concerned. So you're lying there, you've got some machines hooked up, you're in a semi-private room, and 3 days go by and they say, we're going to send you to rehab. And you say, oh, okay, that's covered, right? And the hospital says, well, no, it really isn't, because we didn't actually admit you. You were just here for observation. Now, under the current rules, the hospital is supposed to tell you whether or not you've been admitted and what that means. If you have not been admitted, they're supposed to tell you you're here for observation. This could affect your Medicare coverage for certain benefits, e.g. skilled nursing. Very important. Hospice care is covered and some home health care is covered as well. Now, Part B is your doctor services, outpatient care, again, some home health services, medical equipment, and a fair amount of preventive care, actually. And there is a What's Covered app. Everything has an app. Medicare has an app. This one's actually pretty good. It allows you to look up an illness or issue, and it will give you an idea of what is covered. Is this particular issue covered? Now we'll talk a little bit about the cost sharing and how that works. I think a number of you had concerns or interest in cost sharing. I know Anne shared some questions with me so that I would have a little bit of a sense of, and I'm just pulling those up to make sure that I'm answering them. And there were a lot of questions about cost. So, couple of things. First of all, most of you have had a lot of experience with group health plans, I'm going to guess, of some kind. And with a group health plan, what tends to be true is every year I have one deductible, and I may have 2 deductibles or 3 deductibles per family that I have to meet. And then I have coinsurance, and then I'm done, so to speak. Medicare does not work that way. As you will find, Medicare has deductibles and co-payments and coinsurance for each different category. And so your share in that will be what those are, as well as exclusions, things that are not covered. So let's look at the exclusions first. Custodial care, we already talked about that. Dental care, generally, dental care. Certain oral surgery maybe, but generally dental care is not covered. Eye exams for prescribing glasses. Obviously, if you have cornea problems, that would be different. Dentures, hearing aids. And this last one is a big one if any of you travel, care outside the United States. There's a caveat with that. If you live on a border country, so let's say you live way, way north in Minnesota or Maine, and the closest hospital to you is in Canada, then Medicare may allow you to go there because it is a closer hospital, but otherwise you are SOL is the technical term. That means, let's say I go to take a cruise. About 6 hours out, you're in international waters, Medicare does not cover you. Let's say you want to go to Europe, let's say you want to go to Asia, Medicare will not cover you. The country you're in might provide coverage. However, if you are going to certain countries, I know because of a friend that the Smithsonian Silk Road Tour would be one, the various stand countries like Kazakhstan, etc., no, they do write a check, give me a credit card. Actually, they want cash or credit card. So you can get coverage for that, but you have to arrange that ahead of time. A lot of times for tours or cruise ships, there's a box you can check, I need coverage. Otherwise, there are companies out there that offer that type of coverage. Now, let's look at deductibles and coinsurance. These are some of the bigger costs. Part A, $1,632 deductible for an inpatient stay. That is based on 60 days out. So I stay in the hospital in January. And then in June, I've been home now for 4 months, 5 months. I go back. I have a new deductible because it's been more than 60 days since I was out of the hospital. So when I say this doesn't work like group health, it really doesn't. And that means you have to prepare for that. And Medigap will help. Part B, you have 20% of Medicare approved charges as well as a deductible. So, and that 20% doesn't have a cap. Now, generally, that's not an issue, but what if you have chemotherapy and the drug is very expensive? Then 20% of $100,000 is real money, as they say. That's why we have Medicare, Medicare supplemental insurance, or Medigap. Medigap is that policy, so you get A and B, and then you get Medigap. And Medigap has 8 plans. They're standard. They are priced differently based on the coverage. And it's private insurance that covers the gaps in parts A and B. And they range anywhere from modest coverage. They'll cover no deductibles, but 50% of any copay, to they will cover everything, but essentially your Part B deductible. So depending on where you are, depending on your health, that may or may not be a good option. Most people do get Medigap because it really is a big protection. I can tell you from a cousin that was very ill, it does cover everything. It really will protect you. That said, each person is individual. Medigap policies are all over the map on price. They are very, very regional. So what costs the plan in New York or Illinois may be very different from Iowa or Florida. That is the most local of the things with which you'll deal. Now, Medigap has open enrollment. Here's how it works. You turn 65, right? You get Part A, either because you sign up for it or you have Social Security claimed and you automatically get it. You enroll in Part B. You have a one-time 6-month window when you can enroll in Medigap and they cannot ask you any medical questions. They have to take you as you are. So it's important to know that, because if you try to sign up for Medigap later, it may not work. Now, it is also true for those of you, I know the question is on the tip of your tongue, well, but what if I retire after 65? And the answer is, if you were covered properly by an employer, then you would be in that special enrollment period, eligible to sign up for Medicare and sign up for Medigap. Now, Part D is your drug coverage. Part D is a private insurance plan for prescription drug coverage. Excuse me, I was trying to stop that sneeze and I just couldn't do it, so my apologies. Plans vary in the drugs covered and the costs, and there is a penalty, lifetime penalty for late enrollment. Now, how do I pick a drug plan? Well, first of all, what are your formularies? What drugs are you taking? Generally, if you know your drugs, you can say to the system, you know, when you check on Part D, here's what I'm taking, what is going to give me the best coverage? And it will tell you that. Now, there is something that is a little tricky. Remember, I said there's a lifetime penalty if you don't sign up. So my mom, who passed away in 2012, she was over 100, by the way. When Medicare Part D became available, we said, Mom, you have another Medicare program to sign up for. And she, oh, by the way, her drug regime until she passed away, she took a Tylenol and an aspirin every day. All right. So she was not taking drugs. She didn't have formularies. And my mother, who is a fine British Scots woman, said, I'm not going to pay for something I don't need. Said, Mom, get the cheapest plan. If for some reason you get sick, then we can change the plan you get a one time a year change, and we're protected. You're protected. So even though you're healthy, even though you say, I don't need a drug plan, get the cheapest one. It won't cost you that much. If you need to change it, great. If you never do, that's great too. So let's look at a quick summary of what's called the public option. And this again is your fee for service option. Original Medicare, that's right, Part A, hospital, and B, doctors. Medigap, that is your private insurance that's going to cover whatever the deductibles and co-insurance are, co-pays. And then Part D, which is your drug coverage. And it will vary by plan for cost. It's private insurance, but does provide you with your prescription drugs. Now let's look at Medicare Advantage. So Medicare Advantage is a private option. It is the benefits of Medicare Parts A and B. It typically also includes D, and it inevitably includes services that original Medicare doesn't cover. And those can range from vision, hearing, dental, gym memberships, you know, whatever. And it comes with a monthly premium, and the premiums vary. You'll see in a bit, the premiums are all over the place, but it can be very inexpensive. Now, the trick about Medicare Advantage is these are HMOs or PPOs, preferred provider networks. Now, what that means is that I may have a more limited choice of doctors. I may have a more limited choice of hospitals. It may be that I can go to the doctor or hospital in my county or in 1 or 2 counties, but I can't go any further. It may be that if I'm on vacation, that I'm covered for emergencies, but nothing else. If I go to visit my kids for a month, well, unfortunately, that particular provider doesn't have a shared network where you are, then only emergencies would be covered. So pluses and minuses, these can be very cost effective, but they often have a lot less choice involved. So look at them side by side. You have original Medicare, you have Medicare Advantage, or public and private, fee for service versus managed care with referrals and networks. So one question that I think is important to think about is, do I care who my doctor is? And I don't mean that, and I obviously care if my doctor's qualified, but do I have a doctor that I've always gone to and I want to stay with that doctor? Medicare Advantage may be riskier for that because even though this year the doctor's in the network, next year they may not be. And then you'd have to find a new doctor. So how important is choice of doctor? How important is choice of hospital? How important is deciding to see a specialist on your own, so to speak? With Medicare Advantage, typically you have to be referred to a specialist, while with original Medicare, you could say, yeah, I think I'm going to go see a specialist about this. People have different views of that. As I said, some people are perfectly fine with Medicare Advantage. It gives them great coverage. Other people say, no, I want more choices. I want to have it the way I want it. And remember, you have private insurance. Medigap is pretty much required to limit the risk because there's no out-of-pocket maximum for original. There is an out-of-pocket maximum for Medicare Advantage. And each plan has its own, structure with co-pays, deductibles, whatever. That goes by plan. And Advantage plans are, when I say highly regional, what's offered in the county where you live may be different than what's offered in the county next door. So, which one's for me? Which one will make me most comfortable? And that's your summary. This is the what. Do I want original Medicare or Medicare Advantage? Now, Medicare offers open enrollment where you can reevaluate your Medicare choices and make changes annually. During open enrollment, you can switch from original Medicare to Medicare Advantage or vice versa. That's true. You can switch from one Medicare Advantage plan to another, also true. You can switch prescription plans, and if your formularies have changed or your drugs have changed, that may be something to consider. You can roll in Medicare Part D if you didn't, but you may have late penalties, and all of those are true, although remember, you have a one-time option to sign up for Medigap without medical questions. There are a few states that will give you a certain level of protection, four, I believe, Connecticut, Maine, maybe New York, and one other, but you can check for your state. Most states, if you wait, so let's say I decide on Medicare Advantage, and then 2 years later, I say, I'm having more health issues. I want a little more control here. I want to switch back to original Medicare. Medigap can underwrite you. They will ask you medical questions. They will make decisions on that basis. They can charge you more. They can also decline to cover you. And there are not really very many good workarounds. I mean, if you're in a Medicare Advantage plan, you can try to move to a state where that plan isn't available, and then you would be able to sign up for original Medicare. But I would just be cautious, be aware of that. And that's what we're going to make sure everybody's aware of right now. It's easier to switch from Medicare Advantage to a Medigap plan than vice versa. True, in most states, Medicare Advantage plans have a one-time open enrollment period that starts once you're 65 and enrolled in Part B. False, in most states, Medigap plans have a one-time open enrollment period that starts once you're 65 and enroll in Part B. And the answer is, you have one time that you can sign up for Medigap without questions. 2 times if you count, I'm retiring after age 65, but have always had group plan coverage that's compliant. So be very aware of that. Now, what's it going to cost? Well, we know how group plans at work generally are, right? I have a premium, comes out of my paycheck, and then I have a deductible, I have co-insurance. The deductible's usually for everything or most of it. The co-insurance is usually for everything or most of it. A little bit different for Medicare. The monthly premiums, cost sharing, and exclusions will be your annual cost. Now, we're looking at averages based on studies. So you really do, because it is regional, because where you live matters, excuse me, you really do have to look at the budget based on your circumstances. So you have parts A, B, D, Medigap premium cost, and then you have the private option, which is part A and B, a plan premium, and that's your premium cost. So you have an annual premium cost either way. The question is, how much will that be? So these are general numbers, and you see that by the range that you find. So let's start at the bottom, actually. Part A is zero for most people, no cost. It's actually because you have 10 years of coverage on, your 40 quarters under Social Security, so you generally have Medicare. If you don't have that, you can actually buy Part A, but most people have that themselves or through a spouse. Now, Part B is an annual fee, and that annual fee is based on experience from the prior year. So they do experience from the prior year and a projection, and they say, here is the premium that we expect you to pay this year. And that premium is right now $174.70. So not cheap. I mean, if you think about it, you're looking at $225 a month a piece minimum, because you've also got Part D without your Medigap. So Part D is pretty broad. You have really inexpensive plans. These are, what I call this is what my mom got, right? You got her the cheap plan because she wasn't going to spend money because she didn't take drugs and have a lot of use for it. If you're late, there's a surcharge. If you're in a high cost area or you have a lot of formularies, then it could be as high as 108. Part D with Medicare Advantage, and you can see already there's some price difference, typically is much lower, but it may have much narrower rules. So, be very aware of how that may play off. Remember, you have a PPO or an HMO, more limited rules, probably more requirements for generics as well. And the surcharge if you sign up late. Now, Medigap that's your protection, right? What if I get really, really, really sick? That can range from $50 a month to $300, and that's really based on where you live. It's the plan you select, how much is covered, and where you live. High cost areas, you're going to tend to have the upper range. Lower cost areas are going to tend to have the lower range. Now, Part C doesn't have Medigap. It takes A and B, and often D, but not always, and says, we're going to charge you a premium for all the other things that we offer you. And if you recall, those were the things like dental, vision, gym membership, etc. And that cost could be as low as $0 or maybe as high as $100 or more a month, depending on that particular network. So where cost is a huge issue, people may go towards Medicare Advantage. That can be a great strategy, but do remember, it will give you more limited choices. And if you want to go back to original Medicare, you do have that Medigap issue. It's not important to reevaluate your Medicare choices annually during open enrollment. True, right? Do it once and that should be enough. False. Medicare Advantage and Part D plans change annually from a cost and coverage perspective, so it's important to review current coverage as well as new coverage that may become available. So think about your Part D plans. Maybe the plan you have now does a good job, but maybe there's another plan that has now added the drugs you also require, and they're a little bit better, a little bit less expensive, or they give you more choice of provider. Some of the Part D plans limit where you can get prescriptions, others don't. So that's a factor as well. And of course, with Medicare Advantage, and a classic example would be my doctor went to a different Advantage plan. So now I want to see if I can change Advantage plans because I want to stay with that doctor. So I have to go with false. I have to think, yeah, you really do want to check those two things anyway every year. Now we're going to meet someone called IRMAA, something called IRMAA. IRMAA is the income-related monthly adjustment amount. It is an additional premium that is required for those that exceed a certain adjusted gross income, AGI, plus tax-exempt interest. So your modified adjusted gross income for Medicare is AGI plus tax-exempt interest. And it's based on the two prior years earlier because it's based on your most recent tax return. And your most recent tax return, if this is 2024, even if I filed my 2023 tax return already, doesn't matter. The numbers for this for Medicare come out at the beginning of October or mid-October every year, so before January 1. So they're looking at the year prior, so 2022. Now, we'll see how this matters. If you make more than the dollar amounts in the two left columns on your screen, then you have a bump on the premium. So 103,000 for single, 206,000 for family or for couple. I want you to think about something here. You have two people. Someone's going to pass away. So I want you to go down to about the third line there. And you'll see if you're single, it's 129,001 to 161,000. So let's say you're living, the two of you, on 150,000 a year. And let's say the first one passes away and that drops it down to, 135, 140. All of a sudden, you are going to be paying a significant amount more for your Medicare coverage. You're going to be paying your monthly premium plus that surcharge. And that surcharge, as you can see on the right-hand column, really pushes this up. So a couple things to think about. Roth IRAs, didn't notice that listed. Tax-exempt interest is, Roth IRAs are not. There's reason for that, they don't count. So if you have Roth IRA, that can help you control how much income you have for Medicare purposes. The other thing is being able to time and control recognition of gains. And Ann and Paul can talk to you more about both of these. But if I have a big capital gain and I want to take it, I want to, I've got the cash, I want to make the sale and know that I have the cash in hand, then I'm going to have a tax bill unless that asset is somehow in a deferred status. And that deferred status essentially means I can think about an IRA. I can have a mutual fund go up in value. I can sell it. I don't pay taxes until I take the money out of the IRA. That would also be true with certain annuity products. So that's something I said. Ann and Paul can talk to you more about that. But the ability to do that can make a difference here. Now, what about if something happens? So think about these numbers, back up a minute here. What if something happens that significantly changes my income? Well, in certain cases, you may be able to file what's called a Form SSA 44 and request a reduction of premium. And what would be, how would this work? So my tax return says, here's what you made 2 years ago. Now, income from that year is higher than income in the year currently, right, where you're paying. And the difference is due to what is called a life-changing event. So what might those be? Marriage, divorce, or death of a spouse, stopping or reducing work. The number one way that SSA-44s get filed is, I retired. We were both working. We were making, well above the limits, or we, had a reason that we had that money. We're making well above the limits. We retire. Now we're making under 206, but we're paying like we're making 300. You can go in and say, look, we retired, we stopped work, here's what our income is going to be, and ask for that penalty to be removed. Certain financial settlements and pensions or reorganizations. And another one can be loss of income through a property. So, example, Florida. Florida has hurricanes. Let's say the hurricane totaled your rental property. You were making 50 a year, 60 a year from that rental property because it was in a really good resort location. Now you don't have that revenue. That would be another reason. And if you have evidence, they're going to want to see something, right? If you have evidence of that, then you can request that reduction and often get it. All right, so here's the final exam. Medicare enrollment decisions are important. You may be tempted to roll in Premium Part A at age 65 with current group employer coverage because there's no ongoing premium, so what's the harm? Hey, 2 for 1, how bad can it be? Easier when the current employer coverage ends, I only have to sign up for B and the others. However, if you do you have a high deductible health plan and an HSA? Because if you do, Medicare Part A is not a high deductible health plan, and you lose the ability to contribute to an HSA. So if you sign up, so if you've claimed Social Security and you're 66 and you're working and you have an HSA at work, you're SOL. You have Part A, that's not high deductible, you can't contribute to the HSA. If you have Medicare and an HSA, so if you sign up for Medicare during that initial period, then you can contribute to the HSA till the month before you turn 65. If it's less than 6 months after you turn 65, the month before you turn 65. If it's more than 6 months, then it is 6 months before the month you sign up. There's actually a reason for this. So when you, many of you might know, if you sign up for Social Security, you have an option. If you are 62 and a half years old or older, you have an option of saying, I want to sign up today, but I want 6 months of my payments as a lump sum. Now, that carries you back to that start date of 62 in that example. Because of that, if I have an HSA at work and I'm, say, 67, and I'm going to be signing up for Medicare now, 6 months before I turn 67, I have to stop my HSA contributions or they make you pull the money out. So let's talk about some next steps. Check if you're covered by group insurance, check your benefits office for coordination of benefits if you're still working or you have retiree coverage. Emails are great. It gives you a document that says, I asked this question, this was the answer. Get someone at Social Security to confirm what you know and protect yourself. It can be beneficial to go in and say, I'm 65, I'm working, I work for an employer. They have a group health plan that meets all the Medicare requirements for compliant coverage. Do I have to sign up for Medicare? And they say, no, you don't have to do that. Well, then you have a record. That's what you were told. You can also go to the SHIP program, the State Health Insurance Assistance Program. Those, though, I will tell you, can be very tough to get to. They're often really, really busy, so you may have to be really persistent. I'm a big fan of people who sell Medigap policies. They are a great source of information. Mostly they'll sell Medigap and the Advantage plans. Great source of information. Someone good in that arena can offer great assistance. And also talk to your financial professional. Ann and Paul are great financial professionals. They can help you think about having a healthcare pension. You know I'm going to have premiums. I want to make sure I have a check every month for that. Plan for long-term care. How to handle open enrollment. And as I said earlier, timing and control of recognition of gain, Roth IRA, managing modified adjusted gross income. Now, these are some additional resources, and Ann and Paul will be able to send this out to you afterwards. But beyond everything else, my big thing is talk to somebody who knows. Get some assistance. I think it's really confusing. I've tried to help a couple family members. I'm, in this industry, I do a lot in this arena. I still thought, how could you figure this out? So, Ann, Paul?
Thank you, Susan.
Thank you.
Quite a bit of information there. A lot of moving parts when it comes to Medicare, and certainly a lot to consider for those who are approaching that point in their life where they're thinking about enrolling. I wanted to thank Susan again today for presenting. Special thanks to a couple of people who helped Ann and I put this together, Laura Vorpal, Sam Gurley, and Kendall Hurt, for putting everything together. We really appreciate it. And to those who attended today, thank you very much for taking some time out of your day. There's a lot to consider. If any of your questions were not answered, feel free to reach out to Ann or I. And if we can't answer that, we certainly have a considerable amount of resources at our disposal that we can get some clarification for you. Again, thanks everybody for attending, and I hope you all have a great day.
Thank you.